All right, welcome everyone to this next installment of the InnerSource Health webinar series. My name is Dr. Robert Kochko, and I have the absolute pleasure of introducing Dr. Pina LoGiudice. Um, I've known and worked with Dr. Pina for many years now, and it's an absolute honor, and I've learned so much from her, and I know a lot of her patients come to her with this question around adrenal fatigue. So when we were talking about what's the best topic for a webinar, we always like to focus on the types of questions that people come in with most often. And Dr. Pina really truly is an expert in helping people deal with a lot of the fatigue and anxiety and brain fog and sleep issues that might be related to adrenal issues. And certainly one of the most important tools in our toolkit and tests in our toolkit is to look at adrenal fatigue. So Dr. Pina, as her patients call her, is co-founder and director of InnerSource Natural Health and Acupuncture. We've got practices in New York City and Long Island. Dr. Pina is only in the Huntington, Long Island office. Prior to opening InnerSource Health, Dr. LoGiudice was a predoctoral fellow at the National Institutes of Health in the Department of Clinical Neuroendocrinology, which I'm sure, as she'll get into in a moment, is very relevant. All of her research she did before she went to naturopathic medical school was very relevant to this topic, and in particular focusing on the role of stress and the mind-body connection as it relates to health outcomes. After NIH, Dr. Pina went on to Bastyr University out in Seattle. She's been an author of multiple books. She's a co-author in the newest edition of the Textbook of Natural Medicine. She's written multiple books in her own right related to herbal therapies and healthy skin and healthy hair. Dr. Pina, I'm blanking on the book, but you can give the title, the name, The Little Book of Healthy Beauty, I think
Yes.
is the most recent consumer book, which I actually had a patient just buy yesterday from the office. So those are certainly flying off the shelves, and they make really great gifts as we get into the new season. So Dr. Pina is also a really prolific speaker. She tends to be all over TV, often known as the ND on Dr. Oz. And she's been on other shows like the Katie Couric Show. She's been on Fox News. She's been on Dr. Oz, I think, with it 26 times at this point, 30 times, something like that.
Yeah.
26. So absolutely impressive. And without further ado, I'm excited to introduce Dr. Pina LoGiudice. Thank you, Dr. Pina.
Yeah, thanks, Dr. Rob. I really appreciate it. I'm very excited and honored to be here today. And I think this is a very important, relevant topic for our culture today, especially as New Yorkers. Many of us suffer and unknowingly about adrenal fatigue. So we're just going to talk about some aspects of adrenal fatigue, and hopefully you all learn something. We will have some time for some questions at the end, so feel free to type those in, and Dr. Rob will moderate that at the end. And okay, so here we go. So for today's outline, we are talking about what are the adrenal glands, what causes the imbalance of our adrenals, what are some symptoms of our adrenal issues, some testing options, as well as some treatment options. So and now granted, this is not probably the most in 20 minutes to the most elaborate, because there's a lot of information on the adrenals and a lot of information on the symptomology that adrenal fatigue can cause. But this will be a great introduction to what may be going on with you and what may be going on with your health. So let's start with what are the adrenal glands. So if you look at that top left picture, you would see that the adrenals are this wedge of glandular and neuroendocrine tissue that sit on top of the kidneys. And I always like to say like a crown. So if you see in that, again, top left picture, you have the kidney, and that little top white portion there is where the adrenal glands sit, that's covered with connective tissue. And if you look at the photo to the right, if you slice that gland in half, you would see it has a couple of layers. It is composed of an outer cortex and an inner medulla. And like I said, that whole thing is encased by that connective tissue. And then within those couple of layers, the cortex and the medulla is also further subdivided. So what do these areas do? So the adrenal cortex produces hormones that are vital to life, such as what many of us hear about, that stress hormone of cortisol. Cortisol helps us regulate metabolism and helps our body to respond to stress. It also secretes a hormone called aldosterone, which also helps us control blood pressure. The adrenal medulla produces non-essential hormones like adrenaline and that fight or flight response. So this gland is extremely important in several physiological functions in our body. And we're going to talk about exactly what does that mean and what do they do. So, with that adrenal cortex, like I mentioned, it produces adrenocortical hormones. And I know we're going to get into some fancy science names, but no one's going to test you, so you don't have to memorize them. But the important things is to know is what do they secrete and what do they control. So with the glucocorticoids, it does control blood sugar levels. So it controls insulin, how your body regulates blood sugar. So it's even when you eat food, what does your body even do with the sugar? So does it convert it to fat, or do you metabolize the sugars appropriately? The glucocorticoids also have some anti-inflammatory effects. So the adrenal glands also has an important component with regards to our immune system. With the mineral corticoids, it controls our sodium and potassium levels. So you think, okay, why is that important? But again, when you see blood pressure issues, whether you have low blood pressure, some people say, gosh, I get dizzy or lightheaded, or I have vertigo all the time. It may be because you have too low of blood pressure, or of course, on the opposite end, you can have hypertension and high blood pressure. And that again can be cause of adrenal issues. So when many people are looking and going to their cardiologist, they think, and the cardiologist will say, oh, it's just lack of exercise, or your diet's not right, or whatnot. As naturopathic physicians, we find it extremely important to look at how your stress glands, your adrenal glands, are responding, and looking at these sodium and potassium levels. The last area, it secretes hormones called androgens, and we all know them as testosterone and one of our other grandparent hormones called DHEA, which actually makes many of our other hormones, such as estrogen and the testosterone. So very important, that adrenal cortex. Whereas the adrenal medulla, that other centerpiece, produces the catecholamines. And this is where I mentioned it actually, when I mentioned in the earlier slides, it has neuroendocrine. So when you think of neuro, you think of nerve, and you're like, oh, I don't think this glands can affect the nerves, but it actually can. So there is a part of our nervous system which is the adrenal medulla, and produces these catecholamines, which again, the fancy word is the norepinephrine and epinephrine, which are our neurotransmitters that our brain uses. And you think of it as that fight or flight response. It's that idea of I'm walking across the street and a car comes zooming by, and I don't expect it. Immediately, your adrenal glands squeeze and release some of these catecholamines to get you out of the way. So also super important. So again, when we're dealing with anxiety disorder, anxiety issues, we're definitely going to be taking a look at the adrenal medulla and its function. So what causes imbalance of the adrenal? So the obvious is stress, doing too much, we're not taking care of ourselves, we're overburdening, the typical psychology of our thoughts, again, whether it's even mood issues of just anxiety or depression, or just being an overworked parent, or overextending, or worrying about anything, finances, the state of the politics or the globe. All those things will play an impact. So we are not cut off at the neck. So we're very much, what our mind thinks, our bodies respond. And then again, other people don't realize how their diet can impact their physiology. So if you're, again, not taking care of yourself and you're eating whether fast food or fried foods or foods that are highly processed, that burden on our physiology is extremely strong. And again, most people think, well, I don't have digestive issues, so it's not going to, it doesn't bother me, but they may have all these other inflammatory issues. It could be migraines, or it can be heart disease, or anything else. And what happens is that physiological stress will further exacerbate the adrenal gland. So it becomes like this catch-22, this chicken and an egg problem there. Lack of sleep. Of course, sleep is vital to life. I think it's one of the most important things. Sometimes I say, I think even more so important than exercise. Maybe Dr. Rob might disagree, but I do think sleep is everything. Sleep is the only time our body has to repair and regenerate. Sleep is the only time our body has to detoxify. And again, as very busy people, we feel like, well, if we need more time in the day, that's what we sacrifice. And it's probably like the worst thing that we can absolutely do. People are choosing to stay up later. They're choosing to whether stay up late and sleep in, or if they even have to stay up late or get up early, that sleep deprivation plays a huge impact on our adrenal glands and how it adapts to stress. And of course, lack of exercise. If you are not honoring your body and not taking care of yourself, and you're not burning off that extra insulin because you're not eating right, or you're not burning off those neurotransmitters because you're of the overstress, all of that stuff will increase inflammation in the body and increase strain on the adrenals. And then, of course, negative thoughts, belief systems, being in toxic relationships, all those things too energetically wear on us. But, we're not separate from physical body, energetic body, or spiritual body. So any of our thoughts or beliefs, again, will impact our physiology. So there was this fellow, Hans Selye, in the 1920s, and he was basically, I'd like to call the founder of adrenal fatigue and how humans respond to stress. And he says that stress is a nonspecific strain on the body caused by irregularities in normal body functions. This stress resulted in the release of hormones. So what we do in our human body is that we go through these different stages of stress. So stage one is the alarm reaction. So it's that initial stage of stress. It's like, oh my gosh, I'm not okay. And maybe something short term. So we were like, oh my gosh, there was that car. I moved out of the way. But then you forget about it and it's fine. Then what happens if stress is more chronic, you go into stage two and you get this stage of resistance. And with this stage, that's where you're noticing observable changes in the body's response to stress. And what I mean by that is that now you're getting physical symptoms. So now, maybe you're not sleeping as well, your digestion's not as great, your blood pressure is going up, you're getting some migraines or some headaches, you're getting some joint issues. So any of those things are now part of stage two. Then what can further happen is that if you really just ignore your body and ignore the messaging that your body is giving you, you can go into the stage three, which is the stage of exhaustion. And this is where it's characterized by complete decompensation of the adaptive mechanism. So now your body has no ability to compensate to stress. So now body systems can fail or malfunction. And this is where I think now in the natural medicine world, you hear about functional disorders. And this is exactly what we're talking about, where your body can't go back to that place of balance, or that what they like to use the word of homeostasis, that now you're in this long-term state of fatigue and imbalance. And ultimately, this is what Selye calls distress, this aversive negative state in which coping and adaptation processes fail to return an organism to physiological and or psychological homeostasis. So really, really significant and very, very real. I know it's not uncommon in the conventional medical world that they don't look at adrenal fatigue. They look at the various symptomology the body presents. But, from the naturopathic medical world, looking at the body from the complete whole, you really do see the nuances and the brilliance of what Mr. Selye was talking about. So here is just a very easy visual chart of what happens over time. So in the beginning, your body wants to maintain homeostasis, which is also that balance. But as time goes on, you get that initial blip of the alarm stage where you can get some body systems to decompensate, but it'll go back to homeostasis. But then as time goes on, you will see that resistance and down into that exhaustion stage, which is not good to be in. So what are some common symptoms of adrenal issues? So the most common people will say is, I'm tired, my body hurts, I don't feel good. I'm tired, I have insomnia, I'm not sleeping that great, or my sleep is not that restful. Of course, anxiety issues, depressive issues, digestion issues, hormonal imbalances. These are all common symptoms of adrenal fatigue. I wrote down Cushing's and Addison's disease very briefly because I did want to mention there is a disease state of the adrenal gland, which is Cushing's and Addison. So when a person has Cushing's disease, they're producing way too much cortisol of that stress hormone. And then like some symptoms that you would see is weight gain and high blood pressure, where Addison's, where someone is not producing enough cortisol at all, you can get a hyperpigmentation of the skin, which means a darkening of the skin. You could see weight loss, low blood pressure, low blood sugar. And the reason why I listed it this way is that because you don't have to have the overt disease, but you can have the body present with some of the issues of either of Cushing's or Addison's. So I really do see, like Cellier, where adrenal fatigue is on a continuum. So you don't necessarily have to have the overt Cushing's or Addison's, which again, there are many patients out there that do have these true illnesses. But for the general population, when they have these other underlying symptomology, they can be classified under those other disease states. So what do we do about it? So when you see an endocrinologist, most endocrinologists, if you have symptoms of fatigue or not feeling well or whatnot, they'll run various blood tests. Of course, any practitioner is going to be looking at thyroid issues, making sure your CBC or your red blood cells are okay, that you're not anemic. They're looking at different generalized tests just to make sure that it's not another condition. But one of the basic blood tests for adrenal issues in the conventional medical world is measuring a morning cortisol. And that needs to be measured sometime around 8 a.m. Because that's when the morning cortisol peaks. And it gives us an assessment of how high that is. So obviously there's certain values where if your morning cortisol is ridiculously high, then obviously things aren't correct. The other blood testing that we can do is also test for your DHEA. I actually missed the S. And so DHEA, which I mentioned before, is one of the hormones secreted by the adrenal gland. And again, looking at that blood value, if it's too high or too low, that's also indicative of what the adrenal gland is doing. The other things that we can test in the natural medicine world for the adrenal specifically, there are many companies out there that will use saliva testing for the adrenal glands, where you basically in one day have to spit in a tube. And the great thing is that you can measure cortisol within your saliva, which is very simple. And so a lot of practitioners like using that test. What we use at InnerSource, we used to use the saliva test until this urinary Dutch test came out. And, at the end, Dr. Rob can give his opinion on it. But I do think this is definitely more specific of a test, because what you do with this test is that similar to the saliva test, instead of spitting a couple times a day, since we're all going to urinate, you actually urinate on this little paper card various times in a day. And what this test does, it actually will tell us all about your metabolism of your adrenal glands. So it doesn't just tell us about how are you just cycling with your cortisol, like what is your normal rhythm of your stress hormone, but it's also giving us more specific details about how are you exactly breaking this stuff down, like how are you using your stress hormones. So it's not enough to say that, okay, yeah, you have a lot of cortisol and your body's stressed out, but we also want to know, okay, how are you really using it and how are you breaking it down? And so and I'm going to show you some pictures. So this first slide is actually from an old saliva test panel, but it still shows you something very important. So if the red line is too high, the green line is low, and where you want to be is that yellow line exactly in the middle. So when we're looking at the normal rhythm, you want to be exactly in between the red and the yellow line for this particular saliva test. And what we do find, and this was an interesting study, is that in fatigue and depression, cortisol levels are lower around waking. So if you look at that bottom graph, that morning cortisol, that yellow is below the green. and shows more disorganized variability during the day and do not fall sufficiently in the evening. So you can see that they stay very low. So this person is really tired. So obviously depressed, tired. They're the below line. And then somewhere at nighttime, they finally come into normalized. So this is a very fatigued, depressed person. Where the top image I wanted to show you was the person does okay during the morning, and then around noontime they get tired. In the afternoon they stay tired, and this person, I want to tell you, has insomnia, because if you look at their nighttime cortisol, where that yellow line comes up, it goes way above where they're supposed to be. So I really do find this test very clinically useful. So this image is an example of the Dutch test, or one of the images that we have in our Dutch test. And so again, you can see that this person, so the only thing different with this one is that with the waking and morning, the waking actually represents like that early morning, middle, like that, not quite the middle of the night, but that probably at that 3 to 6 a.m. And this person also has significant insomnia. So you see that they're way overshooting their cortisol. And then as the day goes on, they come down in the afternoon. And then at nighttime, again, they kind of come into normal range. And then looking at to the right here, we also see how this person is, and that's what I mentioned before, breaking down their cortisol. So this is a dial system, if you look between the two stars. So this person has very high free cortisol, which means they have a lot of tissue levels of cortisol. But if you see how they're metabolizing it, they're actually not metabolizing it well at all. So this person is also going to demonstrate that even though they have cortisol in their cells, they're not metabolizing it efficiently. And actually with that, you actually see that dysfunction a lot also with concurrent thyroid problems. So I know it's a little bit weird to look at for the first time, but it's a very useful tool. And here's another one where people say, oh, you know, when I come home from work, I'll have dinner, and then I'll fall asleep on the couch, and then for a little bit, and then I'm up. And then, so I'm really a night owl. And so there really is no such thing as a night owl. Again, looking at this person's cortisol pattern, they're way overshooting at night. So what happens when people get that rest and their body wants to fall asleep, but then they wake up, what's happening is that you're re-elevating your stress hormone of cortisol. Your body's like, wait a minute, I'm supposed to be sleeping, now I'm awake. And so what you think is your second wind really is just a forced elevation of your stress hormone of cortisol, which unfortunately in the long term is more damaging to our physiology. So please honor yourselves and go to sleep when your body wants to go to sleep. So which brings us to some treatment options. So of course, I'm going to mention lifestyle changes because those are primary. Making sure, again, like you are going to sleep at the appropriate time, that you're not going to bed way too late. There's no such thing as a second wind. In Chinese medicine, the philosophy is that every hour you go to bed prior to midnight is actually worth 2 hours of sleep after midnight. So people say, well, if I get the same number of hours of sleep, and if I go to bed at 1, 2 o'clock in the morning, aren't I getting the same type of healing? Absolutely not. Your body has a rhythm to it in the day. It likes to go to bed between 10 and 10:30 the latest. And even if you get up at 5 o'clock in the morning, you will feel that much more better, that much more energized. It'll give you time to meditate. It'll give you time to exercise. So I go to sleep at 9:30, and I think it's super important. If you are having difficulty falling asleep, we do recommend at the office melatonin. I do love this melatonin cadence, which is a sustained release melatonin. I do tell patients with insomnia or depression to do a morning sunlight, to walk around in the morning when it's hopefully sunny outside, not like today, or use a light box. It's very important to get that pituitary or that pineal gland, set for your normal circadian rhythm. Then, of course, with a diet, we're always recommending a clean, organic, whole foods, Mediterranean-style diet, having a good quality, either multivitamin or probiotic. Those are super important in healing the adrenal glands. I do recommend exercise 3 to 4 times a week. I also write down not to overexertion. So we have some beautiful people who really love highly exertive exercise. But, sometimes overdoing it, even though you may feel good in the long run, because I've had many marathon runners or CrossFit people where they're like, I don't understand. I eat well, I exercise like a lunatic, and I'm exhausted. And it's because sometimes the adrenals can't handle that type of exercise, where it does require for you to tone it down a little, not to say to not exercise, but maybe not necessarily to that intensity. So it's definitely a balance when it comes to exercise. And then I'm a big advocate of meditation, having positive thoughts, belief systems, of course, releasing toxic relationships. I always recommend meditation in the morning or before bed. I know for myself, I pray every morning and I meditate every night before I go to sleep. Some people really love journaling. Psychotherapy is great. There are other types of modalities like, obviously Reiki and craniosacral and acupuncture and things that really allow our body to reset, for us to center ourselves and connect with our thoughts and beliefs and really what our soul desires. So then with regards to supplementation, there are so many out there, and that's why I know I love being a naturopath, is because our care is so individualized. So, out there's so many different products that you can try, but I know for all the doctors that work for us at Inner Source, we're very specific on what a patient may need with regards to their potential adrenal symptoms. In general, things to relax our body at first. People can use kava kava, lavender, rhodiola, valerian, hops, and oats. Those are all beautiful things. But if you do find, and you do have the adrenal test, we can look at if you do have too much cortisol. There is a product that we like called Cortisol Manager that has phosphatidylserine and magnolia in it. We do love GABA and lithium orotate, especially if there's anxiety picture and insomnia. And ashwagandha is probably one of my favorite adrenal supports. It's an Ayurvedic plant, and it's really beautiful as an adaptogen. And then if the person has too little cortisol, then I love licorice. And then our Adrenacist has the bovine adrenal cortex, which is really lovely if someone just needs that elevation of their adrenal glands. And I also like Eleutherococcus as a botanical as well. So there are a lot of options when it comes to herbs and nutraceuticals for the adrenal glands. And I know I went over time. I apologize, everyone, but I want to thank you so much for spending your late morning with us here at Inner Source. And if you have any questions, feel free to ask. Thank you so much.
Thank you so much, Dr. Pina. You did go a little over, but you covered so much in so little time, and that was, I'm sure, very helpful for everyone who was able to join and stay on. And I'm seeing most people who joined are still on, so that's that's always a good sign if we did go a little bit over. We did get a couple of questions in, so I'll just take them in an order that they came. The first, you mentioned sort of a modified whole foods Mediterranean diet. Is there something like an adrenal fatigue diet? Does that exist, and what might that look like?
No, I mean, there isn't a specific, like people think, oh, is there like just like a paleo diet? No, again, our care is very individualized. And what the adrenal needs is a very, again, we're also fans of a blood type diet. And I know for myself in my practice, so really for me, a Mediterranean clean diet is the most important, like lean meats, organic, a few grains, a few carbs, high vegetable, some fruits. So very clean, simple food to any physiology, I think is going to be the most important. So do I think people need to necessarily go paleo? No, because sometimes for some, like I know for myself, I'm a blood type A. When I've tried paleo, it's too much of a strain on my system and I actually felt more fatigued. So it's really knowing your body and being able to resonate what is best for you. And for me, and in 15 years of practice, amazingly enough, I found blood type to be spot on.
Yeah. So really finding ways to personalize blood type or otherwise to
Right.
have this foundation of the Mediterranean and personalizing as best we can. Got it. And so that this is a segue from that question. How do you feel about caffeine, coffee, energy drinks? I guess those are all slightly different, but what are your thoughts on those for the adrenals?
Yeah, I mean, most people think I'm so tired. I need something to get through the day, and they resort to caffeine or energy drinks. And I think it's just a big problem because it's a short, quick fix, but in the long run, it's very damaging to the adrenal gland. So when you are trying to heal your adrenals, I actually tell patients to avoid all of those things at all costs and really work on those lifestyle factors I talked about, especially with the sleep and the meditation and maybe doing some Tai Chi or Qigong. And you can absolutely harness energy that way.
Okay, great. Um, and then just time for one more question. I did see a couple of others coming in. Just feel free to email us if you had any other thoughts. Reach out to info@innersourcehealth.com. And our lovely office manager, Lindsay, would be able to connect you with us if you need any, more clinical questioning. But the last question that came in is, how long does it normally take to recover from adrenal fatigue?
Most people think like, oh, I had, digestive issues. I should recover in a day or two. But no, recovering from a true adrenal fatigue can take anywhere from, and I tell patients, at minimum 6 months to a year, if not 2 years. It takes, when you have pretty extensive adrenal issues, it takes a long time to recover. And you really have to be at it and make it your job, to help those glands heal, because the more you damage them, the longer it'll take for you to recover. So it does take some time, but it's about having, grace and kindness with yourself, knowing that you're doing the right things for them.
Got it. Okay. Well, thank you so much. And thank you everyone again who's joined. Definitely check out our website if you haven't yet, innersourcehealth.com. You can also follow us on social media at InnerSource Health, both on Instagram and Facebook and all of those. And I'm sure you can find Dr. Pina through every media channel that you can imagine. And definitely check out her book, The Little Book of Healthy Beauty. You're seeing it on the screen there. I think if I can sort of give away the secret of the book, the skin improves and our hair improves and how we look on the external side of things improves when our insides improve. And certainly adrenal fatigue is one of the things that can impact healthy skin and how we look. So healing from the inside is very important when it comes to that. And this book will show you the way. It'll be a manual for you to do so. So once again, thank you, Dr. Pina. Really appreciate your time.
Yeah, thanks, Rob. Thank you so much. And thanks, everyone. I hope everyone has a great day.
Bye.